I know some of you in your mind, you are saying the last time condom broke. Is that not what brought me to this situation I am? You are saying I should make use of condom. So calm down. This is a disclaimer. No contraceptive is 100% sure. There is still a slight chance, 1 or 2% chance of getting pregnant. Emphasis on slight chance. The only method that is 100% is abstinence. Stay your own, I stay my own. That way, I can assure you, no pregnancy. Now, it is important that you know that for hormonal implants, injectables, oral pills, these are all forms of hormonal contraceptive. And what does it mean? It means that all these forms of contraceptive works on your hormones. They help to regulate your hormones in such a way that you have a lower risk of getting pregnant. Oral contraceptive. Let's begin with emergency contraceptive, postinor. This oral contraceptive should be taken within 72 hours of unprotected sex to prevent pregnancies. You've had unprotected sex and you are not sure, you don't want any surprise baby, and it's within 3 days, 72 hours, you can make use of emergency contraceptive, postinor, right? And you will say special warning, it has to be between 72 hours. After 72 hours, it will not work. Oh. So you're not gonna say your state told us to use it and it did not work. Once it's beyond 72 hours, my dear, good luck to you. Now we have other forms of oral contraceptive that you may have to use for 12 to 21 days, and then you have a 7 days break in between, just depending on the one prescribed for you by your healthcare provider. If you're on this one, it's a free ride. Just they do they go. Nothing to fear about, but I'm coming. I'm coming. Just calm down. The issue with this one is you have to be consistent with your medication. So if you are taking your pills by 8 a.m. in the morning, you have to consistently take it by 8 a.m. You must not miss it. If you have to take it for 21 days straight, you have to take it for that 21 days. You must not miss. Failure to do that, you might just be on the way to another congratulations. So if you're the type that you easily forget to take medication, it is difficult for you to keep up with your drug routine. I would advise you don't go for this one at all. So you don't have cases of missing pills. Also, we have the injectable contraceptive, and the same thing goes for them. You have to be consistent with it. But the good part is that you don't have to take the injection every day. So it might be a 2 month plan or a 3 month plan. Once in every 2 months, you have an appointment with your healthcare provider and you are given the injection. But you still have to be consistent with your appointment. So that's for the injectables. Also, we have hormonal implants. Now we have the hormonal implants that last 2 to 3 years, like the Menstrual and debunk implant. Now the good part with hormonal implants is that it helps couples who are just beginning to have kids. A couple that they are married but they don't want to start having children immediately. They want to wait like 2 3 years before having children. It's very good for them. You can have the implant on, and maybe after a year you can remove it and then start planning to have kids. Now it's important to note that it is not immediately you remove the implant that you start having children. You understand? So after removing the implant, you may still have to wait a while for your body to go back to normal, because the implant, like I said, it works on your hormones and it has changed a lot of things. So you have to, give it a few months for it to regulate back to normal, and then you can start having children. Also, if you are the type that can't keep up with injections or taking pills every day, you can also go for this one, and it works well. It gives you protection for up to 3 years, so it's still a safe play. The downside of this one is it doesn't protect you against STIs at all. Using this, you might experience irregular period, you might not see your period at all, different strokes for different folk. And that's why I said you must carefully go through all this alongside your healthcare provider so that he or she will be able to match the one that is most suitable for you. If you are experiencing any form of symptom at all, you can also refer to your healthcare provider.